Water is life. It goes without saying that any community without access to affordable, safe water and basic hygiene will mark time as far as development is concerned. For lack of these two components means interrupted education, high child mortality rates, deadly disease outbreaks, insecurity, abject poverty, and a plethora of other related problems, making water and sanitation mandatory in the sustenance of livelihoods. In 2002, the United States declared that in commitment to the goals for sustainable development, it would work towards reducing by half the population of people living without access to safe water and basic sanitation by 2015. Pursuant to this, the Millennium Water Alliance, a conglomeration of the largest American humanitarian aid agencies that dealt with water and sanitation, was formed.
Millennium Water Alliance, or well known as MWA, is a coalition of 15 leading organizations, NGOs, that work on WASH across the globe. We do collective programming, advocacy together based on evidence, and right now we are operating in 6 countries in Latin America, 2 in Africa, and 1 in Asia.
We are also looking at tracking and advocating for policy and funding investments in the water sector. We look at serving as a forum where other WASH actors, the local government and the national government can come together and share lessons and best practices that are working, particularly in the areas where water and sanitation conditions are poor.
WASH, an acronym for Water, Sanitation and Hygiene, is the lead program for Millennium Water Alliance. In Kenya, Millennium Water Alliance has been implementing the WASH program since 2004. However, it became apparent that areas of rural Kenya, frequently afflicted by drought and other aspects of climate change, needed the WASH intervention more. This led to the formation of the Kenya Arid Lands Disaster Risk Reduction Water Sanitation and Hygiene Program, KALDRR WASH. The 2-year-long program is funded at a cost of $10 million, $8 million from USAID, while the balance is contributed equally by Millennium Water Alliance partners and Dutch partners under the umbrella of Aqua for All.
The Millennium Water Alliance Kenya Trust seek to improve and create a situation where every single citizen in Kenya has access to water, sanitation, and has improved hygiene practices.
We, as development partners with the Kenyan government and the county governments, are trying to really build the resilience through access to water and sanitation, to provide enough water for people to use water for productive uses, to be able to not only have safe water for drinking, but have enough water for their livestock, have enough water to have a kitchen garden to grow some crops, to make their food situation more secure, to improve their livelihoods.
The program will be implemented in 5 arid and semi-arid counties with Millennium Water Alliance partners as lead implementers.
And he's thanking FH Kenya for teaching them a lot of hygiene lessons and also for building tank in school. He also thanked because they were taught on importance of bathrooms, and they are now building bathroom. Before they were bathing just outside, but now they are bathing in the bathrooms, and they have known the importance of hygiene.
The major components of this program include increasing storage of water for communities in Wajir, as well as working in health facilities in provision of water, hygiene and sanitation services. In addition, we are working with communities in Wajir to make sure that they get safe water for drinking, including improving sanitation and hygiene, because they are highly related to water. We focus on water quality as well as water for livestock, because we know the livelihood for people in Wajir mainly depend on livestock.
We have done a number of things that include VIP latrines. We have also been able to ensure that health facilities and schools are supplied with hand washing facilities. This is just to ensure that communities are able to address the issue of hand washing after visiting toilets, after carrying babies, and after handling other things. We have also ensured that in the same health facilities, issues of waste management is addressed well. This is where we have been able to do an incinerator, a modern one, that is going to be replicated in the entire county, or rather in the entire country.
The project is earmarked to support arid areas health facilities where we have not been having support before on treatment and disposal of healthcare waste. We expect once the project has been launched to be rolled out in other facilities in other counties, including Isiolo, Marsabit, Wajir and Garissa. This is a low-cost project in that it will handle waste from low-volume facilities, what we are calling Tier 2 facilities. It will assist in reducing infections associated with healthcare waste and the risks also associated with healthcare waste.
Vyoo hivi ambavyo vinatumika na watoto walemavu.
These toilets are used by the disabled children and have been a great help. Before, they couldn't access the latrines like other children. The blind ones had to grope around to locate the hole, others fell in, others touched the dirty latrine walls. This would often result to dysentery and other illnesses. This toilet is one of the two that was built for the disabled children. Those in wheelchairs will leave their chairs outside, grab the rails for support and help themselves. The blind will tap for the toilet seat and help themselves too. For sure, dysentery and related illnesses have gone down. Thank you USAID, World Vision and MWA for the toilets and for the hand washing facilities. They have helped us prevent illnesses.
So far we have seen impacts and an appreciation of the community in terms of the work that we are doing. The communities are now able to access water through the facilities that we have, the infrastructure that we have put up. We've also seen improvement in terms of storage capacity within the health centers and sanitation facilities within the health centers. And we've also been able to undertake hygiene behavior activities within the communities.
They have done for us a piping system of water, which they have built for us erected a tank of 10,000 liters. After that, they have built for us a toilet, which is 2 pit latrines for the staffs, since we don't have. And after that, they have even helped the community with hand washing facilities.
Tulikuwa tunachota maji huko mto, na hiyo maji ya mto ilikuwa ni maji machafu, si masafi.
We used to fetch water at the river, dirty water. Our children used to get sick every time they drank it. Also, we lost many people due to crocodile attacks. CARE has benefited us by sinking boreholes. Since then, we can access clean water and we no longer depend on the river. Also, deaths due to diseases spread by dirty water, like cholera, have been halted, as well as crocodile attacks.
Even our goats used to be preyed on by the crocodiles. Our women and children were also afraid of the river. Now, everything is all right. Care has also built a place for us to water our animals. There is a trough outside the wire fence where our cattle take turns in taking water. You will even find wild animals here at night coming for a drink. We are happy and satisfied with this water.
Looking forward, we are looking at working together with the county governments to ensure that they are able to carry forward with their WASH agenda and to also build their capacity in terms of their WASH needs.
The KALDRR WASH programs are designed to have sustainability and longevity.
And we define sustainable water and sanitation access, not only sustainable in the thing that the facilities we try to put in place operate for at least 10 years. We also want to guarantee the quality of the product, quality of water, quality of sanitation. And that is very important, that the facility can support itself on the longer run. What we try to do is to introduce a business approach for cost recovery. On this business approach, we try to involve the private sector, and this involvement of the private sector with innovative ways of financing, involving corporates but also small SMEs on the ground. We do that together with the Millennium Water Alliance implementing partners in countries like in Kenya.
It goes without saying that this program will go a long way in assisting Kenya in achieving one of its Vision 2030, Water for All.
NWA pursues to model pathways to achieve full coverage. We know the importance of water as a transformative force in people's life. We have now very close to complete the 2015 Millennium Development Goals, but we believe that there's still a lot of work to do. We are very happy that the Constitution and Vision 2030 of Kenya call for full coverage of water and sanitation for all the population of Kenya. And we want to be here to support that effort and to be a catalytic force to contribute to the devolution process and working with county governors to achieve that vision.